Justin the Medicare Tutor here, and welcome to Medicare 101. In this video, we'll be discussing the basics of Medicare, a federal health insurance program that helps millions of Americans pay for their healthcare needs. Whether you're about to turn 65 or are new to Medicare, or simply looking for a refresher on how the program works, we've got you covered. First, let's start with the basics. Medicare is a federal health insurance program that's available for people who are 65 or older, or those who are on certain disabilities or medical conditions. It's administered by the Centers for Medicare and Medicaid Services, or CMS, a division of the Department of Health and Human Services, or HHS. There are four main parts to Medicare, each of which covers different aspects of your healthcare. So let's begin. Part A, hospital insurance. Part A covers inpatient hospital stays, skilled nursing facility care, hospice care, and home health care. If you or your spouse pay Medicare taxes while working for 10 years or 40 quarters, you're eligible for a premium-free Part A. There is, however, a $1,440 deductible in 2023 per benefit period with Part A. That's an important aspect to keep in mind. Next, we have Medicare Part B, which is medical insurance. Part B covers doctor visits, outpatient care, preventative services, and medical equipment. You'll need to pay a monthly premium for your Part B, which is based on your income. In 2023, it starts at $164.90 per month. Now, this can be higher if you have higher income. Part B also only covers 80% of your expenses for these healthcare needs. You will be responsible for the remaining 20%. Next, we have Part C, or Medicare Advantage. Part C, also known as Medicare Advantage, is an alternative to original Medicare, Parts A and B. It's offered by private insurance companies that are approved by Medicare, and typically includes your Part A, Part B, and often prescription drug coverage, which is your Part D. Some plans may also offer additional benefits, such as dental, vision, and hearing coverage. Next is Part D, prescription drug coverage. Part D is a prescription drug coverage which helps pay for the cost of prescription medications. Just like Part B, though, you'll need to pay a monthly premium for your Part D prescription drug coverage. There's also Medigap plans that are available, but we're going to focus on two main ones. That is Plan G and Plan N, which are two popular Medigap plans. Plan G offers very similar coverage to Plan F, which is no longer available to new beneficiaries. Now, Plan G covers all out-of-pocket costs associated with Medicare Part A, like that deductible we mentioned, and Part B, that 20%. The only thing it doesn't is except for the Part B deductible, which in 2023 is $226. Now, once you've met your Part B deductible, though, the Plan G will pay 100% of your remaining Medicare covered costs for the rest of the year. Now, Plan N is more cost-sharing plan than Plan G. It covers all of your out-of-pocket costs associated with Medicare Part A, but you'll be responsible for a copayment of up to $20 for some doctor visits and up to $50 for emergency room visits where you're not admitted as inpatient. You'll also be responsible for still paying that Part B deductible. You'll also be responsible for any excess charges if your doctor does not accept Medicare's assignment in states where this is legal, and that can be up to 15%. It's important to note that Medigap plans do not include prescription drug coverage, so if you want that prescription drug coverage, you'll need to also enroll in a standalone Part D prescription drug plan. So should you choose Plan G or Plan N? Well, the answer depends on your individual needs, both health and physical, along with your budget. If you're willing to pay a slightly higher premium for more comprehensive coverage, then Plan G may be a good choice for you. If you're looking for a lower monthly premium and don't mind paying some out-of-pocket costs for doctor visits and emergency room visits, then Plan N could be a better fit for you. So in summary, Medigap plans like Plan G and Plan N can help fill in the gaps that are left behind by original Medicare. If you're interested in a Medigap plan, it's important to compare the different plans available in your state and consider not only your individual healthcare needs, but also your budget. So how do you enroll in Medicare? Well, if you're already receiving Social Security benefits, you'll be automatically enrolled in Part A and Part B when you turn 65. If you're not receiving Social Security benefits, though, you'll need to sign up for Medicare during your initial enrollment period, what's also referred to as your IEP, which starts 3 months before the month that you're 65, the month of, and then 3 months after. So you're looking at a 7-month window total. It's important to note, though, that there are also late enrollment penalties if you do not sign up for Medicare when you're first eligible. So it's important to know your enrollment options and deadlines, along with if you'll be keeping credible work coverage when you turn 65. Now let's talk about Medicare costs. While Medicare Part A is typically premium free, there are still costs associated with other parts of Medicare. Part B, as mentioned, and Part D premiums are going to be based off of your income. There's also deductibles, coinsurance, and copayments associated with each part of Medicare that you want to be aware of, especially if you're looking at a Medicare Advantage plan. Now, if you're looking for additional help with Medicare costs, there are programs available to assist low-income individuals, such as Medicare savings programs and extra help. Finally, it's important to know that Medicare does not cover all healthcare expenses. For example, it does not cover long-term care, dental care, or vision care, unless you're looking at a Medicare Advantage plan where those are available. It's important to consider your healthcare needs and budget when choosing a Medicare plan that works best for you. So there you have it, a brief overview of Medicare. I hope that you found this video helpful in understanding the basics of Medicare and how it works. If you have any questions or would like assistance with your Medicare options, please do not hesitate to reach out to me. We're happy to help. So if you found this video beneficial, feel free to like and subscribe to this channel.